Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. In this final episode of our four-part series on myeloproliferative neoplasms, or MPNs, our focus is on providing the best patient care. Care teams can prevent disease progression by focusing on symptom alleviation and management and disease control. Our guest today is here to talk about the updates to the National Comprehensive Cancer Network guidelines and treatment for MPNs. Dr. Andrew Kuykendall is an assistant member in the Department of Malignant Hematology at the Moffitt Cancer Center in Tampa, Florida. What are the unique challenges you face when treating patients with MPNs?
I think when we talk about the unique challenges in treating MPN patients, I think it's really kind of the more exciting things of treating MPN patients. Every single patient is very different in the symptoms they present with, kind of the duration of the disease, and what their goals are in receiving therapy. And I think that we get patients that are very young, we get patients that are very old, we get patients that present with, very debilitating symptoms. We get patients that present that are asymptomatic. Some have high risk disease, some have low risk disease, and there's just a variety of patients. But ultimately, that often means that we don't have a one size fits all treatment strategy. And some of that's an indictment on our own treatments, right? I think one of the challenges is we don't have, a pill or a medication or an infusion that ultimately eradicates the disease. If we had that, right, it would be a lot easier to make decisions. But instead, we have a variety of treatment options that can provide different benefits for patients. And when you have that, it really comes down to what makes sense for the patient, what makes sense for the disease, what makes sense for the patient's family, and what you feel as a physician is the most appropriate thing for the patient. And so I think that's the biggest challenge is that every single patient is a different challenge to approach.
How are patients impacted by the updates?
So I think one of the things when you think about the updates to the NCCN guidelines, these are a framework of what can be done for patients, and really it tries to build upon the evidence that's put out there. The NCCN guidelines have stayed largely stable over the years since they were kind of initiated maybe 5 years ago or so. But one of the things we're starting to understand is, again, that every patient is different. And they may need different treatment approaches. And certainly we have updated treatments that have gone through clinical trials and shown benefits in different aspects of the disease. It used to be this kind of somewhat one size fits all. If you're high risk, you get on cytoreductive therapy, aspirin, and phlebotomy. If you're low risk, you just do phlebotomies and aspirin, and that's it. Now we're understanding that maybe there is some benefit to initiating treatment earlier, potentially in low risk patients, whereby we may be able to see some impact on delaying progression of this disease, may be able to reduce the need for phlebotomies and improve iron deficiency over time. We're also realizing that some of our agents are very good for symptom control while others aren't. And so you really have to understand which patients are candidates for different therapies that might help more with large spleens or disease-related inflammatory symptoms, while other agents may not be as good for that. And ultimately, I think if we're able to kind of initiate therapy and reduce that risk more so in so-called lower risk patients, we could potentially reach a larger group of patients who don't have that first blood clot, who don't have that first DVT or PE or heart attack or stroke, who ultimately have to get hospitalized, and that can impact their life going forward.
Is this the only guideline that includes a patient symptom assessment form?
As far as I know, it's certainly the most rooted within the disease goals, right? Some of that's an indictment on our treatment, where we're not getting rid of the disease many times. But really, I know of no other disease where truly symptom improvement is used as something the FDA views as reasonable to approve a drug.
How important is that patient symptom assessment form, and how does that impact your team's ability to care for patients?
So I think this is something that is very unique to myeloproliferative neoplasms, where we have this kind of well-validated symptom assessment tool. I think that the challenges a lot of times are in the feasibility of introducing this into the clinic routine and getting patients to fill this form out, whether or not it's part of some sort of online tool, something that's pushed to them while they're at home through the electronic medical record, or whether or not it's a paper form they're filling out sometimes when they come in. I think it's valuable for the care team, but I also think it's valuable for the patient. Many times patients are unaware of some of the symptoms that they may be having, and I think that maybe they try to put on a good face or kind of kind of downplay some of their symptoms that they're having. But what if when you say, hey, we'd like you to fill out this form, just kind of review some symptoms that go on in myeloproliferative neoplasms, take your time, fill it out, come back to it. Oftentimes you find patients that said they were relatively asymptomatic or not so much, right? They're the ones that have substantial amounts of fatigue, of abdominal discomfort, pain under the left side of the ribs, maybe some itching, maybe some a variety of night sweats or something like that maybe they thought were associated with hormone changes or thyroid issues or something like that. When they see it in front of them as something that's part of this MPN symptom assessment form, they go, oh, actually, this is something that I have been dealing with and I should mention. And so I think it takes some of the subjectivity and some of the stresses that we have in seeing patients where we're kind of, stressed for time and trying to make sure we take care of the main things. This is something that allows patients to, at their leisure, really kind of do an inventory on their symptoms. And then when we see that in the clinic and we put that into the chart, we put that into our note, it's something that has to resonate with us and say, okay, well, we need to improve some aspects of this, right? Like, this is something that clearly they're reporting and let's see if we can help that. And then monitoring those symptoms in a serial nature, every month or every 3 months or every 6 months allows you then to look back and say, hey, objectively, these numbers look better than they did before. And even if the patient says, well, I'm not sure if I feel better or worse, you can sometimes go back to those symptom scores and say, well, I know it may be tough to remember because you still have some degree of symptoms, but if you look back, it looks like you've gotten, the symptoms have improved 50% or so from when we started this 6 months or 7 months ago.
Thank you, Dr. Kuykendall. And thank you for following along with this series on MPNs. Be sure to take a look at the show notes for more information on the latest NCCN guidelines for MPNs. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.